Welcome to our instructional video on the importance of rheology in pharmaceutical formulation and product development. When we talk about medicine, most people think about the chemicals involved, but there's a whole lot more to it than just the stuff you see listed on the side of the bottle. Rheology, the study of the flow and deformation of matter, is essential in understanding how materials behave under various conditions. Now you might be thinking, Bill, why should I care about how goopy something is? Well, my friends, in the world of pharmaceuticals, rheology is critical. Think about it. Medicines come in all sorts of forms. Pills, creams, liquids. How easily a medicine flows, how thick or thin it is affects how well it works, how long it lasts on the shelf, and even how easy it is to get into your body. Rheology plays a starring role right from the get-go when we're developing new medicines. Whether we're talking about a soothing syrup for a cough or a topical cream for a rash, we need to make sure that the active ingredients are evenly distributed throughout the product. By understanding how the ingredients flow and interact with each other, we can ensure that our cough syrup doesn't separate in the bottle or that our cream spreads smoothly on the skin. We don't want chunky cough syrup now, do we? Now imagine you're making a giant batch of cookie dough. You wouldn't just toss all the ingredients in a bowl and hope for the best, would you? You'd want to mix everything thoroughly to make sure the chocolate chips are evenly distributed. The same goes for making medicines. Rheology helps us design efficient manufacturing processes such as mixing, pumping, and filling. Have you ever noticed how some salad dressings separate over time? The oil sits on top and the vinegar sinks to the bottom. We use rheology to test the stability of our formulations, making sure they don't separate, settle, or change over time. For example, the rheological measurements of suspensions help predict how well the solid particles remain suspended in the liquid over time, which is crucial for ensuring uniform dosing. If the suspension is too thick, the particles may settle more slowly, but if it is too thin, they may settle too quickly. For emulsions, rheology helps to monitor phase separation, ensuring the emulsion remains stable and homogeneous for the required shelf life. Sometimes we don't want a medicine to release all at once. Controlled release medications do just that, and rheology is the key. By tweaking the flow properties of the medicine, we can control how fast or slow it's released into the body, such as depot injections. Are designed for sustained drug release, rheological properties like viscosity and thixotropy are carefully controlled. This ensures the formulation is easy to inject but thickens once administered, helping to retain the drug at the injection site for extended periods. This means longer-lasting relief and fewer doses throughout the day. Let's face it, nobody enjoys taking medicine, especially if it's difficult to swallow or apply. Rheology ensures that these formulations are easy to swallow and do not drip or spill, while also providing appropriate thickness for adequate dosing. The rheological properties of eye drops are designed to ensure that they stay in the eye long enough to be effective while not causing irritation. A formulation with the right viscosity will adhere to the ocular surface and reduce the number of doses needed. Rheology helps optimize the spreadability and ease of application of topical formulations, making them more comfortable and effective for patients. For example, the product should not be too thick to apply, but should have enough consistency to stay in place. Whether it's a syrup that pours easily, eye drops that don't feel sticky, or a cream that spreads smoothly, rheology helps us improve patient compliance by making medicines more user-friendly. When it comes to medicine, consistency is crucial. Rheological testing helps us ensure that all batches of a medicine have the same flow properties, guaranteeing quality control and giving you peace of mind. As some medicines need to bypass the digestive system altogether, entering the bloodstream directly, the viscosity of parenteral formulations is critical for ensuring that they are easy to withdraw into syringes and can be injected smoothly without causing pain or injury to the patient. Rheology helps us formulate these products to ensure they flow smoothly through needles and catheters, making the experience as comfortable as possible for patients. The future of medicine is all about personalization. Rheology is paving the way for customized medications tailored to individual patient needs. Imagine medicines designed specifically for children, the elderly, or individuals with swallowing difficulties. Rheology makes these personalized treatments a reality. In summary, rheology is a critical aspect of pharmaceutical development, influencing formulation optimization, manufacturing processes, product quality, stability, and patient compliance. It might not be as flashy as genetic engineering, but trust me, rheology is a cornerstone of modern medicine. By understanding and controlling rheological properties, manufacturers can ensure effective, stable, and user-friendly pharmaceutical products. From the moment a medicine is conceived in the lab to the moment it's administered to a patient, rheology plays a vital role. Remember, the next time you take a pill or use a cream, think about the science of flow that made it all possible.